In rural Northern California, healthcare access isn't just about convenience. It's about survival.
The Health Alliance of Northern California, or HANC, has 7 community health center members, and they serve patients across a 9-county region, which makes up 25,000 square miles in northeastern California.
Many of our sites are in very geographically isolated areas with long distances to travel to get to healthcare if we weren't able to have a site in those areas.
In the rural areas in particular, there is nowhere else to go. People don't have transportation. People don't have the funds to take an Uber or something to go 45 miles. Rural medicine is extremely important. We hear about the urban areas, but we don't take into consideration enough how dependent rural America is on Medicaid or Medi-Cal.
Policymakers often ask tough questions about how healthcare dollars are spent. For community health centers, the answer is clear. Every dollar must stretch to meet needs hospitals can't. But it's not just about the amount of funding. It's about the flexibility to invest in staff, services, and programs that keep care accessible. Without that flexibility, clinics, jobs, and the services patients rely on are put at risk.
We are a critical access point for our patients. Our health centers are also, 2 of them, the only providers within that city or town. Cuts to these facilities reduces the access to services that are very much needed. A big one for us is our dental services, and cuts there would just pretty much close our practices because they're already such at tight margins due to funding that we receive for payment already.
We're talking about people's jobs. We're talking about people's lives and their ability to thrive. It's so much more than just saving the tax dollars on, the taxpayers' dollars on the front end. There's this downstream impact that rolls out and impacts us all when the low-income and vulnerable individuals don't have healthcare coverage.
Community health centers care for the whole person in ways that prevent costly outcomes and strengthen entire communities.
I think community health centers are set apart from other primary care providers because we treat the whole person. We treat their any medical needs, any behavioral health needs, dental. We are really the quarterback to our patients' care. We take care of you from birth to grave, making sure that all of your needs are met.
Community health centers treat the whole person. Then the reason we treat the whole person is because we realize and recognize that each one of us comes to the table with psychosocial, mental, physical needs. And the only way we're going to truly start that process of healing is that if we treat the whole person. That is reflected in everything that we do here.
So Northeastern is the only OB provider in Lassen County, as well as some of our neighboring counties. And so for that specialty, we are able to provide services far outside of what our service area actually is. In addition to that, we are currently working on expanding our behavioral health department to include a MAT program. And because we are a smaller community, we have really deep partnerships within the community that help us access and provide care to those that are really deep in the rural parts of our community.
For every dollar spent here, thousands are saved across the system.
So back in 1998, the clinic in Butte Valley and Tule Lake were closed. That forced a transformation of all of those patients going into the emergency room in Klamath Falls, Oregon. We were approached around 1999 to reopen those clinics. The reason we were asked is because the hospital in Klamath Falls, Oregon was spending hundreds of thousands of dollars to take care of the primary needs of those patients. We contracted with the hospital to provide the primary care services for those patients again. The hospital then helped set us up to open those clinics back up because it was such a detriment and hardship on the hospital.
So community health centers have been proven as a cost-effective way to deliver primary care to the populations that they serve. And when their resources are taken away and they're not able to do that job well and they have to reduce services or in some cases close clinics altogether, then people end up using the emergency room, which is not a cost-effective way for them to get their care. You know, we're waiting until things are an emergency before people are accessing care. People have to travel long distances to get to the care that they need. So really investing in community health centers is going to save money in the long term.
Patient care doesn't always happen in an exam room. It can be a community resource center, a dental program in schools, or a safe place to heal after the hospital. What ties it all together is the trust CHCs build with patients and partners.
One of the things that we will also do is try to address issues that are parts of the social determinants of health. So for example, access to food. We have a small food pantry. If it becomes known in the clinic that a patient, maybe they've lost water on their property and their garden isn't coming in like it's come in the past, and so there's a really significant food insecurity, the team on the floor is able to go to the food pantry, make a food box, and send someone home with some sort of food. So we try to recognize what our barriers are in a rural community, like transportation, like food insecurity, and then our clinic tries to fill that gap.
One of my favorite stories is a patient that we had, was a young woman who came in. She actually was referred to us through one of the schools in the area, and she was referred to us for some unmet mental health needs that she had. During providing those services to her, we were able to identify that she was also pregnant and she was homeless. And so our providers working together, behavioral health, OB, as well as our caseworkers, were able to work together and provide care for her to make sure that her physical health was being taken care of, but also we were able to reach out to some of our community partners and get her other needs addressed as well. Today, she has been able to maintain her housing, and her child are healthy and continue to be patients here at the clinic.
Community health centers are the front line of care for millions. By investing in prevention, compassion, and community, we create healthier futures for everyone.
Community health centers are the backbone to the healthcare network and health systems. Without us being available for patients, there really is not a lot of options for them, and a lot of them don't go and seek care otherwise unless there is an access point in their community.
Our health center's mission is clear. We are here for access to care to all of our communities, regardless of their ability to pay. And you'll hear that over and over again. And what does that mean? It means that we're here for everyone. We're here for those people on Medicaid. We're here for people on Medicare, private insurance, those individuals that are uninsured or underinsured. It is so important for us to make sure that we keep our communities healthy.